In the rotator cuff tendonitis, once again, there'll be pain. There'll be difficulty doing overhead activities. They're usually not too bad in a breaststroke, for example. Maybe not even butterfly, but backstroke and freestyle are very difficult because you're having to do a whole lot more use of your arm with your rotator cuff. And there'll be a lot of fatigue when they get through. The impingements, once again, that's usually as you get your arm into the overhead position where you will pinch and rub, and you'll have the sharp pain as they go through that motion.
Biceps tendonitis frequently found with the rotator cuff tendonitis, or they develop separately in swimmers?
Oh, very, very commonly. I think like 85% of people with biceps tendonitis have some kind of rotator cuff problem because the biceps runs in a little groove right on the front of the arm, and the top of the groove, the cover of the groove, is the rotator cuff. And so any inflammation or irritation or damage to the rotator cuff will put the biceps at risk. The other thing that happens is that when the rotator cuff gets weak, then once again this ball tends to slide around a little bit too much, and it will create tension on the biceps as it stretches. One of the other factors that's very, very commonly overlooked is the role of the shoulder blade or the scapula. Once again, all the rotator cuff, biceps, all the muscles, the joint and everything is all attached to that shoulder blade, and the muscles that attach the shoulder blade to the rib cage and to the trunk they are prone to fatigue as well. So if they get a little bit weak, then the shoulder blade tends to slide around to the front of the shoulder, and this makes the rotator cuff weaker. It puts more likelihood that you're going to get this impingement, and it puts a lot of stress on the biceps. As a matter of fact, one of the very first patients I ever saw with these swimmers' problems was a girl who was we couldn't figure out why we couldn't get her better. She had swimmer's shoulder. She had a little bit of instability, a little bit of impingement, a little rotator cuff. We tried all these exercises, couldn't get her better. One day I was having to see her. She was walking into my clinic, and she had a swimmer's tank top on. And her left shoulder, the one that wasn't hurting, the shoulder blade was tucked under the back of the tank top. The right shoulder, symptomatic, it was sticking out on the outside of it, so it was almost sticking straight at me. So I realized that shoulder blade had tilted around. So if you're a swimmer or you're a coach and you see this one shoulder blade kind of sticking out at you, almost like a shark fin, then that's the sign that this shoulder blade's not working well, and you need a lot of rehabilitation to control that because everything works off the shoulder blade.